Hi, I'm Steve Carlson. I'm running for the U.S. Senate in the primary against Amy Klobuchar in August of 2018. I just sent my FEC declaration of candidacy to the Secretary of the United States Senate last week, and today I'm going on Tim Kinley's cable TV show to talk about the race and some of the issues. Here's a preview of the campaign. So why are you running as a Democrat, and why are you running against Amy Klobuchar? So I got involved in 2010, and I can discuss the reasons for that. And when I decided to run for federal office, I had a choice between running as a Republican, a Democrat, or an independent with the Independence Party. I could have run as either a Republican or Democrat because my views and policy objectives have never been determined by any political party. I think that's a very bad way to make laws or show real leadership. So remember the warning of George Washington on that. So I'm not a believer in parties, and I'm an independent Democrat. I've run as a Democrat before, most recently against Betty McCollum. Now I can discuss the affinity I do have with either the Republicans or the Democrats, but basically they are both closed systems that are controlled by party activists, regardless of what policies the voters of Minnesota might want. And this partisanship, for the sake of partisanship, is really wrecking the country. And I think Donald Trump is addressing that. And so party platforms obviously don't control how representatives in the Senate or House are going to vote. And so the positions advocated in the nomination process or the general election are largely symbolic. And I haven't heard really Amy Klobuchar say much at all. But democracy is not symbolism. It's hard and skillful, informed, and wise decisions on the nation's laws and on the many critical issues the nation faces today, such as jobs, the economy, national security, and national unity, which, by the way, I believe in. And so for party activists in either major party to exclude the real demand for solutions and leadership when making a selection and for national unity is really unfortunate, because that kind of hyper-partisanship, for example, these superdelegates and voter quotas for delegates for demographic bases like women, minorities, etc., this is really destruction of our Republican form of government and of our U.S. Constitution. Now, unfortunately, the Independence Party, when it was a major political party under Minnesota law, had many of these same problems of activist control. Basically, local people took control and cut the party off from the national reform or national independence parties. And it did play a fairly disruptive role in our federal elections and gubernatorial elections, the so-called spoiler. And of course, the biggest spoiler of them all, Governor Jesse Ventura, is a legacy of that party. And Donald Trump is also a legacy of that party because he won the California primary in 2000, I believe, for President of the United States with the Reform Party. But he decided not to continue at that time. But I chose the Independence Party for a number of reasons. First, it appeared I would have a strong shot straight through to the general election ballot for the U.S. House of Representatives 4th Congressional District nominee of the party. Second, and that did happen, and second, obviously the DFL was going to be backing Obama. And I was motivated by what the National Democratic Party was doing, motivated negatively to jump in the race. Two quick issues that motivated me were, one, the destruction of our healthcare system with the so-called Obamacare, he doesn't care, and the very real threat of closing down Gitmo and transferring terrorists to Thompson, Illinois, which I found out was just about 150 miles down the river from here. So it was decided. And of course, the destruction of the Independence Party as a major party happened because the same locals who had cut the organization off from its national roots used it basically as a way to influence the governor's races and support socially liberal Republicans against the GOP establishment. Again, that was not my motivation. Why are you bringing the issue of Minnesota's treatment of women in the federal breast cancer screening program into the race? And what is that about? Well, here are the biggest issues about this scandalous and dangerous treatment of hundreds of Minnesota women. Now, no one in the government has done the work to make sure we're not throwing Granny off the cliff and setting up a death panel in the counties who ultimately administer these benefits when a woman is diagnosed and treatment is begun for her breast or cervical cancer. Now, I don't have much direct knowledge about the cervical program, but I do know about the breast cancer. I worked 14 months as a resource specialist at the American Cancer Society's Midwest office in Eagan, and that was a lifesaver, literally. So because the lawyers of the government have not done any work, I've had to do the heavy lifting. First of all, at the law library and then online. And I understand this is a kind of first impression case in the Minnesota courts. The appeal of the termination of my wife's breast cancer treatment insurance benefits while she's still in treatment. Now here's what we know. Women who are diagnosed with breast cancer when they are 65 years old or above are not eligible to have their treatment fully paid for by Medicaid and the Medical Assistance Breast and Cervical Cancer Program in Minnesota. They can get Medicare, which will cover about 80% of the cost of breast cancer treatment. And I've been told by workers at United Hospital that they have to turn to charity for chemotherapy for those people. So that is unacceptable from a cancer treatment point of view to me. A big part of the problem is timing. Timely treatment for cancer is, as you know, critical, a matter of life or death in many cases. It certainly was in my wife's case, and we bless God that her life was saved in 2013. But if she had been 65 at that time instead of 62, things could have been different. So really, that's one scandal. And if I'm elected to replace Amy Klobuchar, I will immediately work to extend that treatment program to cover the sweet spot, if you will, for getting breast cancer. An oncologist told me online that the age is 62 years to, I believe, 69 years. I would urge that women diagnosed, even if on Medicare, be put on this categorical Medicaid program with Medicare as the primary provider. I believe that would save tens of thousands of lives. So this categorical Medicaid program or benefit is not based on income, but on the treatment. The categorical Medicaid eligibility is just a vehicle that the U.S. Congress chose in 2000 to fund the treatment program. I believe it was Senator Danforth's idea. Now, many of these women would not ordinarily be eligible for Medicaid, but are in the cancer treatment program during the time they require breast cancer treatment, and so are given this categorical eligibility, which is being taken away. People are being thrown off of that in the middle of treatment. And it results in medical problems and in a less efficient, less economical, and lower quality of medical care, which violates all of Medicaid's rules and regulations. But the big scandal here is that when women are eligible, because they're not yet 65 when they're diagnosed, and treatment is begun, the scandal is we have hundreds of women at least in Minnesota alone who have been thrown off their breast cancer treatment coverage while they still require cancer treatment. And because they've had cancer and are in actual treatment at the time, they can't get insurance the way you or I could, or any woman who has not had cancer. This is a pre-existing condition, and supposedly Obamacare was supposed to be so great for pre-existing conditions. And Trump has expressed concern for this as well. And we hope Donald Trump will stand up for these women getting tossed out of their insurance when they need it the most. Now, this is really something. The state denies women the right to make the decision in their private relation with their doctor to continue and complete their life-saving cancer treatment using Medicaid dollars. And they argue that no meaningful benefits, the state does, are needed for cancer patients. But on the other hand, the Minnesota Supreme Court has ruled that women must be allowed to get an abortion using Medicaid dollars. And the argument, or the ruling actually, is that if it's legal to get an abortion in this state, the state's medical assistance must cover it completely, or the state's violating that legal right. The same goes for a transgender operation. The state must cover that according to the courts. Well, it's also legal to complete your cancer treatment. And we're arguing that under the state's privacy provision in the Constitution, which the Minnesota Supreme Court has ruled is much stronger than the federal privacy provision. And as you know, this is a penumbra of rights based on judicial interpretation. There really isn't any privacy clause in either Constitution. So we're saying, since there is a privacy right and the state must pay for it, or legal rights are violated, we're arguing that the state must pay medical assistance to pay for this treatment under this same Minnesota Supreme Court precedent. And the commissioner's arguing, through Lori Swanson, that we can't raise this abortion issue for the first time on appeal. Well, of course, this really isn't an appeal. It's a judicial review provided by statute. And what's really shocking is that the Minnesota legislature will not let you raise a constitutional question in an administrative review. And that's all you get is administrative reviews. And I think this is illegal, and it violates the U.S. Constitution, and it's basically given Commissioner Emily Piper, who was the general counsel of Mark Dayton before he sent her over to be the commissioner in charge of all this, and it gives her a constitutional free zone. And she's never restored the benefits which were taken away from my wife, even on appeal. And she says we can pay the first $500 or so each month and whatever it takes to get our household down to the 80% of poverty level, and then we can send excess medical bills. So we're raising this Minnesota constitutional issue about abortion versus breast cancer treatment, as well as federal constitutional issues about taking a woman already in the cancer treatment insurance program and cutting her off before her promised treatment is finished. And the harsh reality of this case is that when you get into politics, bureaucrats, especially Democrat government workers, attack your rights. So my wife was diagnosed in 2013, and she's still finishing her cancer treatment. And already in 2014, during the election period, of course, one of these bureaucrats, Terrell Nelson at Ramsey County, just threw her off her insurance. We were able to get that restored. But then they demanded that my wife get a note from the Social Security Administration that because she was only 62, she couldn't get Medicare. This continued again in 2015, and then during the 2016 elections when I ran for the U.S. House against Betty McCollum. So during the 2016 election, on November 8th, 2016, on Election Day, I was being contacted by faceless bureaucrats I've never actually met. And I should have, because they're supposed to come forward in the hearing so I can see them and face and question them before a human services judge. But one of these bureaucrats was supposed to be talking to me basically about why in July 2016, just at the time I ran in the primary against Betty McCollum for the 4th Congressional District seat, they had thrown my wife without any rationale or justification out of her cancer treatment insurance while she was still in cancer treatment and required treatment according to doctors. Someone went into my wife's records and terminated her from the MABC benefits in July 2016, precisely at the time I had announced I was challenging Betty McCollum for the U.S. House of Representatives. And I believe it was politically motivated, because it happened without explanation or rationale 5 months before her 65th birthday. And they never put her back on. And this is an actual finding by the Commissioner of Minnesota Department of Human Resources, Emily J. Piper, who is an attorney and in fact as I mentioned, was Governor Mark Dayton's general counsel and deputy chief of staff when he appointed her as the commissioner. I believe this was in 2015. But again, this is happening to hundreds of women. They're being thrown off their cancer care insurance during treatment. And Jack Rogers said on his podcast, this is just wrong. And we should be all over the legislators who wrote this to get it fixed now. Now I need to say that I also have explored the law on this. Lori Swanson has not. She just presented a political lawsuit and bullied people and has not even looked at the law. And a couple of things. First, these women, once they have been accepted and treatment begun under the federal program, are protected by the 14th Amendment. They need a fair hearing. And when the state gets to that fair hearing, they're going to run into something called the equal access provisions. So any program change, such as throwing Granny off the cliff, needs to be evaluated as to its impact on the efficiency, economy, and quality of care of the affected patients. And further, the interpretation of the Medicaid Act itself must be in the best interest of the patients. And some of my fans here are getting a little too excited about this. So that decision interpreting the Medicaid law, which is going to throw her off the cliff, says Medicaid says we got to take her cancer care away, that has to be evaluated according to the best interest of the patient. And this is not. Throwing them off is not in their best interest. And we've argued further that under the 14th Amendment and the 15th Amendment, this discrimination, because women attain 65 while in treatment and are thrown out of treatment insurance, while younger women are not thrown off, this does not pass muster because it's irrational. So there is a rational basis for cutting out women when they're 65. Because at least the government can argue that it's saving money by focusing on the younger age group. But what's the rationale for allowing women into treatment and then randomly throwing them off because of their birthdays and the length of their cancer treatment, which can now surpass 5 years with the use of the hormone treatment? Further, the state should show a compelling state interest in cutting their cancer treatment insurance during promised treatment. Why should a woman who is 2 years younger be allowed to complete the treatment she had started, while my wife and hundreds of other women may not? Now, hormone therapy, for your information, it suppresses the production of estrogen in a patient, and it cuts the risk of relapse in half. And that's why it's standard practice and must be recommended and provided to women who require it, and this is according to a federal district court ruling in Idaho. And finally, the state is arguing that they need this money for welfare, because after a woman is in cancer treatment, she's sent down to the welfare department, who then seizes control over her cancer treatment. And obviously they are not qualified to do this. They're putting lives directly at risk. I know that the way the program has been set up, the state gets paid at 75 to 25% match for the breast cancer, compared to a 50-50 match for Medicaid. And they're arguing that they are not expected to provide a meaningful breast cancer benefit to any of the women, regardless of age, because of the fiscal burden and administrative burden to the state. But of course, the U.S. Supreme Court in Goldberg versus Kelly held that this state interest is far outweighed by the compelling state interest the state has in not erroneously declaring a recipient of these medical care payments ineligible. So we believe, in fact, we know the treatment of my wife has been erroneous. And we believe this is true as well of these hundreds of other cases. And we're asking for an impact study under the equal access provisions and an audit by the state auditor of this practice. So, why have you been involved in litigation over elections? Yes, well, I served on the University of Minnesota Elections Commission as chair in the 70s and 80s, and it's critical the rules are fair in a democratic society. such as we say we are. But as Donald Trump said, it's rigged. And by now, with Amy Klobuchar, Al Franken, and James Comey, and Robert Mueller, it's obvious they are, by the CIA, FBI, etc. But no one wants their campaign for office to be about lawsuits. And I never got involved in that until 2012. Betty McCollum was ranting on the stage in a debate I had with her at the state fair about fighting for voting rights and how proud she was. Well, I happen to know that because of gender quotas and race quotas, etc., white men are excluded from being voting delegates in the nomination process. They're limited to about 35% to 40% of the votes. Men and white men are literally thrown off the delegation at the precinct caucuses and at every step, so that at least 50% of the vote will be for Amy Klobuchar. Will be women who will then be voting for Amy Klobuchar. And that's how she got elected. And this is happening all over the nation. So I made a rap about it called Make It Count, because Keith Ellison wanted a rap the vote contest, not rock the vote. But part of the rap went like this. Up here we've always talked about integration, but instead we're spreading quotas all across the nation. And that's true. And I don't think that Ellison gave me a prize. And I plan to put that message, Make It Count, on a mass emailing to all the voters in the congressional district, because I had been promised by the Secretary of State that I could buy those email addresses for something like $30. But when I used the disk, they weren't there. I called Nancy Breen at the Secretary of State office, who didn't know what the problem was. And then Burt Black came on. Their counsel started telling me it was private data I couldn't have. Well, that's an obvious lie, since the Minnesota Data Practices Act makes clear it's presumed public. Mark Ritchie had actually brought email addresses home with him from the office and used them to support certain Democratic candidates and raise funds, including for himself. And the legislative auditor found that was perfectly legal. But Betty McCollum didn't want her opponents to have access to those email addresses. So we went to court, and basically the Minnesota Supreme Court ruled that they don't ever get involved in elections except for typos on ballots and possibly lawn signs. That's bunk, of course. Ellen Page basically put Al Franken in the U.S. Senate, and after that they didn't want to ensure constitutional practice in our elections. I know this MVA case at the U.S. Supreme Court, they tried to argue that too, but apparently it didn't work. And I hope the court will clarify that for our state. One of the things I noticed when I started to listen to the oral argument at the MVA case is that people apparently may be turned away from voting if they wear the wrong t-shirt. And I hope the court overturns that, because people shouldn't be disallowed from voting at all for reasons that violate the First Amendment, because some poll judge doesn't like the way they're dressed. But they must force the Minnesota Supreme Court to stop denying jurisdiction over these election cases, because it's just bad administration of elections. Our legal rights are important. Delegates should not be legally excluded because of their gender or race. The First Amendment requires that voters and candidates be allowed to communicate, including with the emails that they provide voluntarily, and not just through the fake news mass media. And the state court should enforce that. Debates as well. Certainly major party candidates should not have been allowed to be excluded from publicly broadcast debates. And I litigated this as well, beginning in 2014, when Amy Klobuchar and Al Franken started to box independent party candidates out. Eventually they destroyed the Independence Party, and I litigated that as well. Why do you support Donald Trump? And could you work with him as a Democrat if elected to the U.S. Senate? Absolutely, I could work with Donald Trump. The other side in the DFL, including especially my opponent Amy Klobuchar, who's proud she's a classmate of James Comey, it boosts her ego somehow. and also Richard Painter are running on impeaching Donald Trump. And I'm sure Al Franken, wherever he is proud he started this impeachment campaign going when he read a CNN article to Jeff Sessions, who stupidly recused himself and put deep staters like Rod Rosenstein in charge. But of course, Trump had to get someone in there because the job was taken over by Sally Yates, who undermined Trump's national security measures in the federal courts and directed DOJ lawyers not to defend executive orders. And that's why they got struck down. So I'm against impeachment. Further, I support the whole Make America Great Again approach. We need to secure the borders, stop enemies from entering the country, keep transportation safe, stop nuclear proliferation. But especially on jobs, healthcare, and education, I'm with Trump. Unlike Amy Klobuchar, I don't want to shut down the government. If you look at my Twitter account, I have a photo of Amy standing proudly next to Chuck Schumer as the shutdown drew near. And she did shut the government down. This is unacceptable. The Minnesota voters should vote her out. So she wants to undermine the presidency and shut down the government. Now what we need to do is have stronger trade and lower taxes. What we really need, Tim, is to reverse the growth of the federal debt and transition the power and resources back to Minnesota and the other 50 states. Stop sending our money and our sovereignty out to Washington, D.C. Drain the swamp. So these stronger economic policies have already greatly increased employment and the gross domestic product, economic growth, and it's just kicking in. And we need that. And Amy Klobuchar would try to stop it. On education, we need to get back to basics. If girls are interested in STEM, science, technology, and engineering, and mathematics, great. But let the boys study to the highest level they can. We can't be importing our STEM students from other countries, as we are, and it's hurting the country and the state. On healthcare, no death panels, no throwing granny off the cliff. We need the market system to work, and now we can hardly get insurers to offer anything. Don't cut Medicare. Amy Klobuchar sat there in Congress as women are thrown off cancer care, supposedly, the judge tells me, because of Amy, because of the legislature and the Congress. She has failed to protect women's health care, even against cancer. And she sat there as Barack Obama cut Medicare by 1/3 to fund Obamacare. And I'm also a staunch defender of the free exercise clause and religious liberty, and always have been. So, am I a conservative? Yes, I'm both a conservative and a liberal. I consider that a false dichotomy. What do conservatives want? To preserve what is best in our society. That must include our liberality, our compassion. Although we must, just like in the healthcare debate, make decisions to preserve the liberty of patients and providers and insurers alike. But what do liberals want now? Well, I want inclusion and I want equal opportunity. We still don't have it. We have quotas and affirmative action. The key to boosting equal opportunity is real education, a vibrant economy, strong families, and compassion. These are important to Donald Trump's America First, and I'm a firster. Now, why do you compose and perform rap music? Good question. Why do you sing songs you've composed? Well, from the beginning, I have played patriotic songs for my website on the keyboard, which is Steve Carlson for US Senate 2018.com, by the way. Because if I wasn't a patriot, I would never be running. I have strong beliefs in the values of the United States and also Minnesota. And I want to clearly express those values. I realize that once you present yourself for federal office, you need to define yourself and your issues and values, or others will define them for you, and they still try to define them for you, you know. And by writing poetry, essentially, and performing it, I can communicate and define not only those issues and values, but how I actually feel about it. My very first original composition, which was something like Vote for Change, Vote Independence, It got written up in the national press, even the Washington Post, which, okay. And reporters noted the evident strong feelings I had, for instance, for our soldiers in Afghanistan and why they were there. I've written about pro-life for the unborn. And actually, my work on treatment of breast cancer patients on the Breast and Cervical Cancer Prevention and Treatment Act of 2000, which the state and county are supposed to be faithfully implementing for women diagnosed in the SAGE program, found to have cancer, fits right in with this kind of advocacy through song. Now I say song, but it's really rap music. I've been composing, for instance, All Lives Matter. Lately I've used John Coltrane's Giant Steps as the foil, as it were, for a pretty intense version of Fight Like a Girl, Can't You Feel the Rage? So I guess that just about completes those preview questions and answers that I'll be presenting to Tim Kinley, and I would say that's a pretty good kickoff for my campaign. I am in the primary against Amy Klobuchar. I will be filing with the Secretary of State here. I have already filed the FEC form with the U.S. Senate Secretary. So I'm all in. And these are some of the issues. You're going to see the breast cancer issue because it affects hundreds of Minnesota women just in Minnesota and obviously the entire country. We could be saving tens of thousands of lives. We could be reducing incidents and cost and suffering and mortality from this. It's a vital part of the war on cancer, and I've always been at the forefront of that. If you'll remember, when I ran with the Independence Party, I said the kind of healthcare role that the federal government should play should be attacking killer diseases. And I had cancer directly in mind, having come from the Cancer Society. This was before it impacted my family. And reducing health disparities. And this program for low-income women is a health disparities program. It helps people who usually get kind of disparate treatment because they don't have access to a kind of a program which can get to them right away before the cancer does. And thank God that I knew about that and that our family was able to be spared from that. And really every year is a special year that's been granted to us by God. I do believe in God. I do believe that there should be education opportunities in the private schools because, as I told my brother yesterday, if you believe in God, you believe in the truth, and you're necessarily interested in inquiring into the truth and what your role is in your society. How are you supposed to make your society work and make the world better? And so I just wanted to say that. I've set out some of my issues: jobs, education, healthcare. Those are things which I will push. I've given you some very good specifics, and I hope that you will continue to follow me at my website, on my Twitter feed, and on my Facebook account, and will show up to vote for me in the August primary, and if necessary, to sign a petition to get on the general election ballot. I received 50,000 votes in 2014, at least, even though Al Franken and others excluded me from the debates and told untruths about me in the fake news media. And I have challenged them directly on this, and they know that, especially Associated Press, NPR, but others. Still got 50,000 votes. If 2,000 of those show up, I can challenge Amy Klobuchar throughout to the general election. But I want to win this primary. So I couldn't go to the caucuses and conventions because, wouldn't you know it, just about then there was the very first court hearing in history since 2016, which Lori Swanson showed up through her surrogate, and John Choi showed up through his surrogate, and as my wife said, told so many lies that there was really no reason to even hang around, but there is a reason. and I could not go to join you in the caucuses and conventions, but I want you to listen to my message because I present a strong alternative to Amy Klobuchar, who is kind of milquetoast, wouldn't you say? I mean, what actually does Amy stand for? Hot dish, I guess, and with all due respect. And impeachment and anything basically that Chuck Schumer tells you to do. I understand she's supposed to have a drug program, which is definitely something we need to address, but I kind of tend to think that Donald Trump has a much stronger approach. While I haven't been able to totally study everything that he has, one thing I noticed is that he wants to help American pharmaceutical companies so they can create more jobs and so they can better meet the needs of the people here in the United States and don't have to compete against freeloading foreign countries. And what freeloading means is the companies in those countries don't have to do the research and development, which is always a big part of any drug. And so I think probably his program is a lot better. I'm going to look at it, and so far I really haven't seen anything from Amy Klobuchar on that. She doesn't have a business mind, and I don't really think that she's pushing for the law and Constitution to be enforced. I think she's a little bit negligent of some of the things that are impacting the people here. I suppose she's done her best, but basically she came from being a prosecutor and is happy to be in the Senate but doesn't know what to do. I do know what to do. I have decades of experience, not just running for federal office, but in the University of Minnesota governance. That is an arm of the state of Minnesota government. It's a branch of government according to the U.S. Supreme Court, and it's true. So that's another decade. So all of these things, I believe, will make me ready to start on day number 1. And I look forward to debating Amy Klobuchar. And I certainly hope she comes out and debates me, because I'm ready at any time, and as a trained attorney and member of the Senate and public speaker, I'm sure that she should not be shying away from me. All right, thank you for listening. Again, my name is Steve Carlson. I'm running against Amy Klobuchar in the primary, and I've given you a little introduction to the specifics of my campaign, which I hope you'll find interesting and that you will agree with and support me so that we can have human rights, equal opportunity, and liberty in our wonderful country and make America great again. Thank you.